This is Dr. Dante Graves. I'm Director of Non-Invasive Cardiology at St. Thomas Heart. I'd like to share with you some of the cases we have accumulated over the past few years with our involvement with three-dimensional echo and helping care for our cardiac patients. We find it extremely valuable and useful in caring for the sickest of patients that have significant valvular heart disease, both preoperatively and postoperatively. We look at clots, devices that have been implanted, overall function and volumetric echocardiography in these patients. Today we're going to look at several examples where we find it clinically beneficial in the care of our patients here at St. Thomas Heart. In this image here, you're able to see the aortic root and the aortic valve. What we're looking at is an aortic root dissection, and you can see the tear and the intimal flap very nicely in this three-dimensional image. You can also see the integrity of the aortic valve in the far left of the screen. This is the three-dimensional short axis view of the aortic valve. You can see it's a tri-leaflet valve. One of the leaflets is heavily calcified and fixed. This brings to mind either inflammatory or a degenerative type process that we see with aortic valve pathology. This three-dimensional image just delineates that so nicely for us. Oftentimes, we're asked to determine the integrity of prosthetic and bioprosthetic valves. This image is a bioprosthetic mitral valve that has insufficiency or is leaking. On transthoracic views alone, it was difficult to determine the exact pathology or the pathophysiology of this valve. When applying the three-dimensional echo technique, one can certainly see that the regurgitation or the leak is coming outside of the annular plane, therefore making us suspicious for a paravalvular leak in this bioprosthetic mitral valve. This image is displaying a full volumetric image of the mitral valve, the tricuspid valve, and the aortic valve around the 12 o'clock position here. This shows the full volume of using three-dimensional echo and how we're able to obtain all the integrity of the leaflet and the leaflet structure to help us further diagnose the pathology of these patients with significant valvular heart disease. It aids in surgical treatment, determining repairability versus replacement, and on whether these patients will be offered surgery at all. Three-dimensional echocardiography with transesophageal probe allows us to look deeper into the patient, into the heart structures. In this view, in the right lower corner with the flesh tone color, one can see a tunnel. This is the left atrial appendage. And in the 9 o'clock portion of this, you can see a string or a stream of blood or blood flow. We would never see this in our conventional echocardiography. With three-dimensional transesophageal echo, we're able to see more clearly and to help us choose the appropriate treatment for these patients. And this particular patient with a clot that you can see as described, we did not do cardioversion because of the increased risk of the patient having a stroke. So this provided very valuable information, and this is data that we would not have had a few years ago without this technology. In this image, you can see the reconstruction, a three-dimensional echo of the mitral valve apparatus. This is the anterior leaflet of the mitral valve in the top position and the posterior leaflet of the valve in the lower position. One can even see the individual scallops, and if you'll notice, in the 10 o'clock position of the mitral valve, there's a bulge or a mass. This turned out to be a tumor called fibroelastoma that was only able to be visualized when applying three-dimensional technique to echocardiography. This allowed us to decide on the appropriate therapeutic technique to apply to this patient with a surgical resection of this mitral valve fibroelastoma. Again, we can only see this by three-dimensional technology. We're asked oftentimes, and in this image, we're asked to determine what type of pathology has occurred with the patient with mitral valve regurgitation. In this image, you can see anteriorly the anterior leaflet, and you can see this ruptured cord or this tear around 1 o'clock. It's extending down into the valve plane. The posterior leaflet is the bottom part of this screen. You can see in great detail that that's a supporting apparatus called the mitral valve cord that has become torn, most likely from either mitral valve prolapse or a patient that had a myocardial infarction and had damage to that area of the mitral valve apparatus. This patient had severe mitral insufficiency and went on to have emergency open heart surgery for mitral valve repair. We're able to clearly choose the appropriate type of treatment for this patient because we were able to see it in such great detail using a three-dimensional echo. Not only are we able to look at valve structure and anatomy, we're able to apply three-dimensional echocardiography in parametric imaging. And as you can see in this image, we're looking at a patient with hypertension. This is the heart structure in short axis, and we're evaluating the radial thickening, and these time velocity curves show the amount of thickening for each particular segment. This is allowing us to evaluate patients with hypertension that may be predisposed to having heart failure in the future and may need more aggressive treatment modalities applied to them in our practice today. We're allowing other image modalities to be applied with the three-dimensional technology, again gathering all the data that we can that helps us to determine the exact pathology occurring in our patients so we can best choose the appropriate treatment plan for them. This truly is individualized patient management as well, utilizing three-dimensional echo.